Hello, my name is Troy Randle. I am a cardiologist with Virtual Cardiology, South Jersey Heart Group, and Program Director of the Cardiology Fellowship at Rowan University School of Osteopathic Medicine. Welcome to CVI Heartbites. You will notice that this CVI Heartbite is a little bit different from others that you may have seen. I am here with you to share my firsthand experience with COVID-19 and stroke. As we get started, some of the common symptoms with COVID-19 are feverish chills, cough, shortness of breath, fatigue, muscle, body aches, headache, new loss of taste or smell, sore throat, congestion. Some people may experience nausea, vomiting, and diarrhea. There's really no set symptom or presentation for anyone. Different people present differently. When we talk about the shortness of breath, is not usually an initial symptom. It's something that is usually progressive over periods of days. But fevers and chills and cough, as well as the muscle aches and fatigue, are very common for the symptomatic patients. When we talk about COVID-19 and stroke, there was a study that was published in Stroke Volume 51, which looked at the characteristics and outcomes of patients with COVID-19 and stroke, mostly because of this hypercoagulable state. And in this hypercoagulable state, it was noted that we had some arterial thrombotic complications, possibly mediated by inflammation, endothelial dysfunction, platelet activation. We knew initially about this hypercoagulable state and noticed some pulmonary emboli. However, early on, we did not know about the stroke. In this study, it was noted that the most prevalent stroke risk factors and comorbidities were hypertension, obesity, diabetes. This will take me into my story with COVID-19 and the stroke. And going back to the initial COVID-19 symptoms, typical symptoms we talked about, well, what did I experience? The ones that you see asterisk are the ones that I personally had experienced during my episode of COVID-19. Generally, my practice after work was to come home, get undressed in the garage, run up to the shower before I interacted with family. This one particular day, after I came out of the shower, I felt like I was hit by a truck. Myalgias, body aches, fevers were very prevalent right from the start. It lasted for about 5 to 6 days. I had a headache, which lasted for 2 days. Tylenol really did not alleviate a lot of my symptoms initially throughout the day. My symptoms were worse at night. Throughout it all, I did not notice that I had a loss of taste or smell. However, we had our house power washed, and my wife asked me if I noticed the chlorine scent, and I did not notice that. So that's when I had noted my loss of smell. Diarrhea really wasn't anything that I had prolonged. I may have had like one or two bouts, so no real GI symptoms. The biggest part, again, was the headache, fevers, myalgias. Again, nights were worse than the day. Uh, at that point in time, I was taking some nutritional supplements, quercetin, zinc, vitamin D. Again, try to help with the immune system. Tylenol was to help with the fevers and the myalgias at that point. Uh, this was early on, and initially, I believe that I had obtained COVID from a colleague. It was before we were generally wearing masks routinely, and in the reading room, even though we wipe down all surfaces and all, you can't prevent something that's airborne. So, we were wearing masks when we were going into patient rooms with suspected virus. However, routinely at the onset of COVID in our geography, we were concerned about having enough PPE. So it wasn't until actually after I initially had COVID that it became more widespread for everyone to wear PPE routinely at work. But in the reading room is where I suspect that I had picked up COVID-19. At that point in time, the policy was for healthcare professionals, if you were a week outside of onset of your symptoms, AFib for a 72-hour period, you were free to go back to work. Uh, when I had returned to work, approximately 2 days into my hospital rounds, I subsequently began to have headaches again. Felt like a vice squeezing my head. Uh, at that point, I wasn't sure what was going on. I reached out to some colleagues that I had known had experienced COVID to see if they were having any recurrence. They had all denied that. I reached out to some colleagues for some advice in terms of how to move forward. Was in a process of trying to have repeat COVID testing. However, the headaches were very intense. I tried ibuprofen as well as acetaminophen, and neither provided any relief of the headaches. At that point in time, somewhat being stoic and not wanting my family to see me vulnerable, I left the house. I began to walk and started praying because I knew that there was something that was wrong with me. I had no idea at that point in time that I was having a stroke. I had the headache. I think that if it wasn't in the environment of COVID, I probably would have acted sooner because I generally don't get headaches. But again, I had a headache when I first began experiencing the symptoms, and that clouded my judgment somewhat. Uh, Later that evening, my wife became emotional because she saw me with the headaches that were unbearable and the body aches again and fever, and she wanted me to go to the emergency department. At that time, I really did not want to because thinking COVID, I said that all they're going to do is tell me to self isolate again, and as she became more emotional, I subsequently decided to go to the emergency department. However, I only wanted to go to emergency department if I knew the attending physician that was working that evening. So she called 3 different emergency departments before I decided to go to one. And part of that is I suspected I would need a CT of my head. And I didn't think that if I didn't push for that somewhat, that would happen. Because again, with the COVID, when I initially presented, the emergency room physician did not want to do the CT again because of the headaches and relation with COVID. However, I'm glad that she listened to my complaints and ordered the CT of the head. At that point in time, that came back abnormal. And I had an emotional breakdown because I had no idea what abnormal meant. They just told me that they saw something on my brain. We had no idea what it was. Uh, at that point in time, do we do a lumbar puncture to see if this is infectious? Do we treat this as vascular disease? The idea was to get an MRI of my head to determine whether or not this was vascular or not. However, that would be a delay of a couple hours to get an MRI. And then, what if this is infectious? How do we handle that? So we decided to treat with IV antibiotics just in case if it was infectious. We didn't want to take the risk of a lumbar tap at that time. Again, not knowing what was going on and having so much unknown with COVID. So after the MRI was obtained, it was noted that I did have a cerebellar infarct. My vertebral artery had thrombus on the left vertebral artery, which subsequently caused a 5 centimeter cerebellar infarct. Luckily, there was no edema. I spent a couple days in a neuro ICU. and neurology suspected that I had some fine motor deficits, which I think in hindsight, I'm very thankful for. I suffered some vertiginous symptoms and dizziness, especially with rapid movement. So I compensate for that and don't move quite rapidly. So overall, considering how things could have been, I feel very blessed. I missed the window for any sort of surgical intervention uh, or lytic therapy because of the delay in my care. And again, I'm very blessed that I'm in my position. I was treated with aspirin, Plavix, and statin uh, for for the embolic phenomena. The Plavix was for 30 days, and currently I am maintaining treatment with aspirin and statin therapy. When we talked about those risk factors earlier in terms of hypertension, diabetes, obesity, I did not have any of those risk factors myself. I may have only had BPH in terms of medical issue. I was taking statin therapy as a cardiologist. I highly believe in the benefits of statins and having a family history of coronary disease. I prophylactically took statin, but not necessarily because my labs had warranted it. Again, from a preventive medicine standpoint, I had taken the statin. Unfortunately, during my bout with COVID, I discontinued my statin use because of the myalgias. Subsequent studies have come out to report benefit of maintaining your statin therapy on COVID, maintaining your statin better. Further studies have come out showing the benefits of maintaining your statin therapy uh, while you have COVID. However, with the severe body aches and muscle aches, I did not want to challenge that with statin. In hindsight, I wish I would have continued my statin therapy. Um, at this point in time, I think that is questions like how do we handle COVID-19 and people that are self-isolating and quarantining at home. Generally in the hospital, people with higher viral loads, sicker patients, we're treating with anticoagulation. At home, we are not. There's no evidence to support it, but in hindsight, uh, I would support aspirin therapy, 81 milligrams, for 1 to 2 months, unless you have a high risk of bleeding. Again, there's no evidence to necessarily support that, but considering my experiences, if I could turn back the hands of time, that's what I would do. I want to thank you for watching this CVI Heartbite segment. If you have any questions for me, please email CVI's executive director at cvi.markhartnett@verizon.net. That's cvi.markhartnett at Verizon, Verizon.net. And questions will be sent to me. For more information on other CVI segments, as well as other CVI educational programs, please visit cviphiladelphia.org. Stay safe, be well. Thank you.